cerebral palsy and exercise intervention. Let's start with the basics. What is cerebral palsy? Cerebral palsy, or CP, is a non-progressive neurological disorder that originates in the brain. CP generally emerges during fetal development. The main causes for this developmental defect are brain lesions, injury, or illness. The cerebellum, basal ganglia, and cerebral cortex are the areas of the brain most commonly affected. CP occurs in about 3 out of every 1,000 births. That may not sound like a lot, but that means that around 30 babies are born every single day with CP. To diagnose it, doctors have to look at the symptoms expressed in the patient, then categorize them into spastic, dyskinetic, or ataxic CP. Spastic CP is the most common. It's characterized by muscle rigidity and tightness, sometimes causing painful spasms and nerve damage. Dyskinetic CP is characterized as uncontrolled, involuntary movements that are often repetitive. These patients experience mixed muscle tone, meaning that they also may experience symptoms of spastic CP. Ataxic CP is very rare. It accounts for about 2% of CP cases and causes balance and coordination issues. Unfortunately, a common symptom seen among CP patients is losing their ability to walk. This is believed to be a symptom of worsening muscle integrity and nerve degradation from years of movement dysfunction caused by the CP. So, how is this condition treated? Typically, doctors prescribe physical therapy, muscle stimulation, and drugs like muscle relaxants and Botox. But what about exercise? We already know that exercise increases brain plasticity, blood flow, and stimulation, so what if we prescribed exercise to patients with CP? Thankfully, there are a lot of studies that have been done to evaluate the effects of exercise in patients with CP. Let's look at a few.
The first study tested 26 adolescents with spastic cerebral palsy over 12 weeks to see the effects of speed treadmill training on muscle spasticity, strength, and overall physical function. They compared their speed training with the typically prescribed strengthening program for CP patients. The scientists behind the study hypothesized that the treadmill training group would have better outcomes than the strengthening group, but their results were not supported. Both groups saw improvements in muscle tone, strength, and gross motor functions, but the speed training group maintained the results better after the trial ended. Even though it's not what the researchers expected, it supports the idea that exercise is a good way to positively affect CP symptoms.
The second study used a lower body strengthening program for 8 weeks to evaluate leg strength and function in 16 adolescents with CP. Researchers hypothesized that their muscle strength would increase without increasing spasticity symptoms in the patients. Increased muscle strength is important because it can help improve walking gait and prevents muscle atrophy. Participants train 3 times a week on a high-resistance static bike, 6 sets, 10 to 15 reps at almost 70% maximum muscle strength. By the end of the trial, muscle strength and motor function had improved significantly without affecting muscle tone.
The third study compared backward walking to forward walking in 30 kids with spastic CP to evaluate the training differences on walking gait and motor functions. The kids in this study were required to walk 3 days a week for 25 minutes, in addition to their hour-long physical therapy treatments. By the end of the study, no big differences between walking types were found, but both groups show significant improvements in step length, walking velocity and coordination, cadence, and gross motor functions.
Each of these studies found that exercise-based programming can be beneficial for treating CP symptoms.
Muscle weakness, walking issues, and coordination can all be improved with consistent exercise training. By finding new, safe, and non-invasive ways to decrease symptom severity in CP patients, we can improve their quality of life and decrease their chances of worsening pain, muscle death, and injuries as they age.